I'm Dr. Sri. I'm a board certified family medicine and sports medicine doctor with a background in exercise physiology and integrative medicine. In this video, we're going to discuss whether weight loss can improve one's symptoms of knee osteoarthritis or not. So without further ado, let's get started. In my clinical practice, I encounter a lot of patients with knee osteoarthritis, and I help manage their pain through targeted exercises, medications, and sometimes joint injections such as steroid injections, viscose supplementation injections, or platelet-rich plasma injections. If you want to know more about these injections, make sure that you check those respective links in the description box below. However, it's important to understand that the treatment that is offered in the office, such as these medications, joint injections, are not the only one that can help with your knee. Lifestyle factors also play a crucial role in the treatment of knee osteoarthritis. For some patients, weight is a significant modifiable risk factor. In other words, the knee pain may worsen due to excess weight, regardless of the severity indicated by X-rays. While I can prescribe treatments to manage symptoms that comes from knee osteoarthritis, managing weight, quitting smoking if one is smoking, exercises, both targeted exercises for the knee as well as aerobic exercises to improve cardiovascular health, all these three lifestyle factors can improve one's knee health. So how does weight loss help? So first, it reduces stress on your knee joints. It's also important to understand that osteoarthritis isn't solely about joint wear and tear, but it also involves chronic inflammation. So when you lose fat tissue, you start to decrease the hormone called as the adipokine. Even though the hormone adipokine, they have both pro-inflammatory, which means that they increase inflammation, as well as anti-inflammatory, which means that they decrease inflammation. The balance between these two is very important to maintain body homeostasis. But excess adipose tissue can disrupt the balance, thereby increasing the pro-inflammatory, so basically increasing the inflammation. And by decreasing one's weight, you decrease this pro-inflammatory factor, and thereby this leads to less chronic inflammation and thereby lead to less joint deterioration. How much weight do you need to lose to see a difference? A study in 2025 analyzed nearly 9,000 adults and found that even a 2.5% change in weight can lead to symptom improvement. For example, if you weigh 250 pounds, losing 5 pounds can make a noticeable difference. Furthermore, the more weight you lose, the more your symptoms can improve. Another important finding in the study was that the initial weight did not matter. So what that means is that, so let us say I've got a 250-pound individual suffering from knee pain, I've got a 350-pound individual suffering from knee pain, and if they both lose almost 2.5% of the body weight or 5% of the body weight, it did not matter what the initial weight was. They both had symptom improvement. In addition to that, the study also included strengthening, exercise, psychosocial support in addition to the weight loss. So all these factors could have also played a role in helping to notice a symptom improvement. So that's why I tell my patients to adopt a healthy lifestyle eating habits. So that includes an anti-inflammatory diet. And if you want to know more about anti-inflammatory diet, I'll include the link in the description box below. We talk about knee-friendly aerobic exercises. We talk about targeted exercises to strengthen the knees. In addition to that, I talk about mindfulness for stress reduction as well. All these lifestyle factors will eventually lead to weight loss and thereby helping to improve the health of your knees. So those unable to attend formal physical therapy can benefit from graded home exercise program as well. I personally created a home exercise program for knee osteoarthritis, and I'll include the video at the end of this video, and you can get started with the home exercise program if you have trouble going to formal physical therapy. For some patients, if they have trouble losing weight in spite of those dietary modifications and stuff, I prescribe weight loss injections, and some patients may benefit from a bariatric surgery as well. So basically, in summary, if you're struggling with knee osteoarthritis and weight-related issues, setting micro goals for weight loss can significantly improve your pain and quality of life. If you want to know more about how I treat patients with overweight or obesity, then make sure that you check out this video here. This video will provide you in-depth discussion about how I manage patients with obesity. We'll talk about exercise, nutritional strategies, we'll talk about medications, pretty much like everything that you would need to know to start with your weight loss journey. If you want to get started with the home exercise program for knee osteoarthritis, then check out this video here. And every other links that we talked about, the injections and everything, I'm going to share those links in the description box below. And I'll see you in the next video. Until then, goodbye.